Dentistry is not a happy profession. Primarily, anyone who comes to me is in pain. Nobody really wants to come to you, with a happy mindset. Unfortunately, that's when we as we discussed first, that we would rather see you without problems every 6 months to say hi. But that is still a long way to go in India. So see, when a patient comes to us, primarily they are already in pain. Now, the fear of having that pain and plus the procedure which may inflict more pain. So that's the root cause of anxiety, I feel. Other than that, a childhood traumatic experience that they may have had, a previous bad experience, it all stems down to what we feel inside. And probably, grandma's tales or some YouTube or some research that we've probably done earlier. There's so much content out there that just puts us off guard. So anxiety primarily stems from there. But understanding that we are here to help you, not here to hurt you or judge you, is the first step. So primarily, first it starts with understanding the problem and understanding that the patient, well, while we are empathizing with them, that we know that they are in pain, and knowing that we are trying to help them out of the pain. Understanding why and what is their major concern, why they feel that, probably their, understanding where the anxiety stems in from, that helps a lot. Understanding if there was a previous experience which probably caused this, and what we can do or what our techniques are to make sure that they will be more comfortable while doing the procedure, explaining the procedure beforehand, making them understand of what to expect during and post the procedure helps a lot. So, sedation dentistry, when we talk about it, there are two or three ways that we can work around it. One is that we can use an oral pill, some medicines that can be given for the night before for the patient, so that helps them sleep better and just helps regulate the anxiety. Second, what we can use during treatment is something called nitrous oxide or laughing gas, if you've heard about it. So what that does is, it's a small nasal hood that is put on top of the nose, and it sends out some flavorful gas along with oxygen, so it reduces the general anxiety of the patient. It is also called as conscious sedation, where you are conscious, you are talking to us, you are aware of what is going on, but you are still at a much calmer position. So you are able to accept and undergo the treatment without having the fear or the perception of pain. And the third and the more severe form, or is for reserved for more complex cases, that is the IV anesthesia, what is also known as general anesthesia, what is practiced in hospitals and operation theaters. So that is all a part of the process. Now, because the world has become a much smaller place with the advent of technology, what we do is, if a patient is very reluctant to come in for a consult where they feel that it just does not allow them physically because of their anxiousness, we do request and allow these virtual consults, where we first try and video call or talk to the patient and understand that their concerns are. Music therapy or something is, we have some TV screens that we have attached to our chairs, where we can have their favorite show or series or a movie running. We give them headphones, we give them noise cancelling headphones with some music going on. And of course, there is some great scents in the clinic that we have with essential oils that also helps a lot. But it's primarily the counseling, understanding the problem, and working with the patient, making them realize that we are on their side. We are working as a team. It's not us against them. It's us with them against the problem what we are trying to solve. So that is what primarily helps us take this to the next step.